Let's talk about bulimia nervosa. Now, this is the girl who typically binges and purges, and the reason she does that is based on her self-image. She has a sense of self-evaluation. How she sees herself is how she thinks she's going to do in life. If she doesn't look a certain way, she won't get the job. If she doesn't look a certain way, she won't get the boyfriend. So it's more of a self-evaluation than a distorted sense of self like you find in the anorexic. So there are two subtypes of bulimia. One is the purging type and the other one is the non-purging type. As you can imagine, the purging type is the one that has the self-induced vomiting, the laxatives, the diuretics, etc. And the non-purging type is the one that will either exercise or fast. Now, the risk factors associated with bulimia are usually psychological conflicts regarding issues of control, again, body image, how they look, and of course, feelings of guilt or helplessness. What the studies have shown is that most of the girls who have bulimia nervosa were probably girls that were overweight at some point in their lives, and this is basically the only way that they have found to control their body weight. Also, some of these girls could also have mood disorders, which could be the cause of the bulimia nervosa. Now, this is much more common than anorexia, anorexia being 0.5%, whereas bulimia is 2%. Also more girls than boys at approximately 9-to-1. This occurs during later adolescence. The peak incidence of bulimia usually occurs during the first few years of college. And just like anorexia, it's usually chronic and/or intermittent. The difference is that girls who have bulimia tend to do better. So 70% of the cases have remitted, whereas anorexia, it's not that high. And what's important is that also, if these girls use drugs, they definitely have a poorer prognosis with the bulimia nervosa. And just like the girls with anorexia, the girls with bulimia prefer to eat alone. Why? Because if they eat alone, they could serve themselves these huge portions of food and nobody is there to control them. If they're forced to eat with other people, then what typically happens is that they serve themselves smaller amounts of food, but yet they have hidden food all over the house. So when you're not looking, they're going to go to their food spot and eat it quickly. So the key symptoms of bulimia will be their recurrent episodes of binge eating, probably inappropriate compensatory behavior. So you're going to have the purging, the abusing of the laxatives, etc. And they're going to base themselves on what they look like. Some of the associated problems could be depression, substance abuse, and even impulsivity. Borderline personality disorder is one of the ones that is most likely seen in girls who have this disorder, occurring in about half of the cases. And if you were to do a physical exam, it's going to be similar to that of anorexia in that you will see the evidence of the purging, but you will not see the emaciated conditions that you do see in the girls with anorexia. The difference being that the girls with bulimia tend to have normal, slightly above normal, or slightly below normal weight, but mostly they hover around normal. If you do diagnostic tests, you'll probably find the evidence of laxative or diuretic abuse. Now, the treatment, again, try to use behavioral therapy. One of the things could be allow these girls to eat and then not allow them to leave the room. Therefore, they do not engage in any kind of purging behavior. Psychotherapy could be helpful, especially if they're borderline, and antidepressants, specifically the SSRIs. And the reason being that they believe that bulimia nervosa is associated with serotonin. So therefore, SSRIs are the treatment of choice. And the biggest differential diagnosis, of course, will be anorexia nervosa. Also, just binge purging, major depression, and the borderline personality. Now let's review a case. A 19-year-old woman is hospitalized for dehydration caused by severe laxative-induced diarrhea. She is depressed about the recent breakup of a romantic relationship. She admits that she uses laxatives because she has been binge eating frequently and is worried about gaining weight. Although the woman is very thin, she believes that she is overweight. She's never had a menses. Which of the following is the most likely diagnosis? Anorexia, brief psychotic disorder, bulimia, delusional disorder, or major depressive disorder? If we review the case again, you will find that the girl has been binging and has been abusing laxatives. Many of you, because she's binging and abusing laxatives, would immediately pick bulimia nervosa as the answer. However, that is not the answer. The correct answer is A, anorexia nervosa. Why? Let's go back to the case. You'll see that she's very thin and she believes that she is overweight. That is called body image disturbance. And the fact that she's never had a menses, those are the two things that are basically diagnostic for anorexia nervosa. So the answer is A, anorexia nervosa.